We are governed in American healthcare by the for-profit interests.
In a typical year in modern America, approximately 68,000 people will die due to lack of adequate health care.
Health insurance companies are in the business to make money, and they will do whatever they can to avoid paying claims.
The fallout is they would rather make a sale than take care of a patient.
If me and Danny lived in Canada, if me and Danny lived in Mexico, me and Danny would still be living in Canada or Mexico. They're not just numbers, they're people. They're ripped from us because of our greedy healthcare system that puts profits before people.
This is a profit-driven business. They can be sued if they are not acting in the best interest of their shareholders, not in the best interest of the patients.
So the problem is greed.
The Democrats and the Republicans are both in the pockets of Big Pharma and the insurance lobby.
We're at a real tipping point.
The people in this country know the system is broken.
It's time for change.
Yes, it is. Well, it was time for change 50 years ago or so.
Yeah.
But that I think it was really good. And even though I know Amy, it's like hearing her when she gives her story is extremely powerful.
Oh, yeah.
The same for you, Scott. And the same for when everybody who has been touched by this greedy system. I was. I don't normally share this story, but I will. I had a near-death experience when I first moved down to Florida. This was in the fall of 2014. I had a really gut-wrenching pain in my abdomen, and I wasn't sure what it was, but I had laid down. This was on a Saturday night, and it was probably like 1 o'clock, but there was a voice in my head that said, you need to go up, you need to get up and go to the hospital. Just go. And so I did. And sure enough, took a few hours, but lo and behold, they discovered that, and I'll never forget this. The doctor walks in and he says, you don't know how lucky you are. Your appendix is going to burst probably within about 45 minutes. We got to get you into emergency surgery right now. I made one phone call to my father just to let him know. He knew immediately when I called. He said, what's wrong? Said, I have to make this call and just let you know that if this is the last time I talk to you, I have to go into emergency surgery because my appendix is going to burst. And if I had gone to sleep, the doctor said I wouldn't have probably woken up in the morning. And so thankfully I was safe. But that $4,000 bill that I got on top of having pretty good health insurance, for most people, they can't pay that. And so if you can't pay it immediately, it's like credit card debt. It's going to spiral out of control to the point in which you can't pay it, and you'll be in debt forever. And so the idea that this system exists is sick. And when people, in any way, shape, or form, try to defend this corporate system that we're living in, especially when it comes to healthcare, it's a nightmare. It's an absolute nightmare. And I'm one of the lucky ones. Most people aren't so lucky. And that's why this issue is so goddamn important.
For sure. I think what you just described is becoming the foundational American experience. I mean, I don't know anyone who hasn't either had a similar experience themselves or someone very close to them has. And then in your situation, you're talking about something that actually threatened your life, like immediately. And that's one level of like severity. I got the $4,000 bill for getting a maybe skin cancer thing checked out, right? I just said, hey, this looks bad. Maybe we should get this looked at. And then the $4,000 bill comes and I go, well, next time one of those things shows up, how am I going to feel about getting it looked at the next time? I mean, this, it's backwards. We are completely backwards of how healthcare should work. The powers that be are using the fact that we get sick and that we are mortal as a way to squeeze more money out of every person with a heartbeat. And it sickens me every day.
Yeah. I would argue we don't have healthcare, actually.
No,
we don't have healthcare. We actually have like sick care. And some of it's the best in the world for the people that can access it, right? Like we do have like illness care, disease care. Like we do have those things. We do not have health care in this country. And that is also, it's another issue, but we have great care in this country for people that can afford it.
Well, that's one of the problems we're always looking at is actually the narrative that is given to us by both parties. They're both saying, healthcare is a human right. The Democrats are saying the Republicans are trying to take away your healthcare by, destroying the ACA. And the Republicans are like, well, no, the Democrats are raising the cost of your healthcare by putting all this red tape in with the ACA, right? But neither of them are really talking about healthcare, are they? They're both talking about health insurance. And health insurance actually profits by denying health care. So what they're selling us is a contract that they will profit by not giving us our medicine and saying that the other one is trying to take that away from you. Yes, both of them should take that shit away from us.
Yeah. Yeah, one of the big
give us health care.
Eye-opening things making the film was how many of these really tragic, disturbing stories that we've been able to gather from all over the country had to do with people who had insurance, right? The problem isn't people need insurance to save their lives. Insurance isn't solving the problem. People are dying every day in this country who have coverage. The coverage isn't the solution, and that's the false bill of goods that we're being sold every day.
Yeah. Well, that's the Democrats' line, right? Mm-hmm. Like if we could at least just get a public option, right? Like if we could just get the public option, then everything would just be fine. And it's like, no, because as long as it's a for-profit system, it's not going to be fine. There's no way to make it be fine because you have incentives that are not the health of the people. So it's sort of like, I feel like about Jews for Jesus. It's like this oxymoron. You cannot have a for-profit health insurance industry and expect it to care about health. That it's completely counterintuitive.
Yeah.
What I'm running into with people on the political right is obviously their biggest fear is it's government run. I don't want government run healthcare. But what I will say has become crystal clear for almost every one of them that I ever speak to is that they clearly see now that there is absolutely no point whatsoever to Aetna, Cigna, United, Blue Cross Blue Shield. They have no business in our system whatsoever. They do not add value, as is the conservative capitalist mindset of what are you doing to make this better? You are not doing anything. And the fact that Big Pharma, as it has been proven over the course of the pandemic, was never concerned about saving people's lives from COVID. It was about how much money can we extract from this absolute tragedy. That's it. And so getting them to kind of see that element is a huge shift than from where we were when Bernie first came on the scene in the spring of 2015 saying, we need a single payer healthcare system in America. And everybody, of course, went berserk over that by saying, oh, you're trying to make this into a communist country. Well, a lot of people are kind of getting past that point now. And I do think we're reaching a new crescendo, if you will. The question is, can we start to bring enough people over to realize that what we're fighting for, a universal healthcare system through single payer, is the removal of the for-profit middlemen in between us and our doctors?
Yeah. That's why it was, by the way, that was a stellar Bernie Sanders impression. Just
when
wow.
He's in the studio, he puts on the mask. And
well
he
done.
Actually, it's actually really good. Yeah.
Okay.
Kenny, hold on. Kenny, before you continue, I want to say to all of you guys,
You close your eyes, it's good.
you do a really great job with those red berets. I can't wear them, even though it's good for my head, especially in Vermont. It gets very cold. Scott, I just want to say love to you and your family. The fact that you have to struggle through this ridiculous for-profit health system. Your son should be alive. And Kenny, you made yourself a really great documentary. I hope everybody gets to see it. And hopefully a lot of people will enjoy it. So there you go.
All right. Well, I'm taking the audio you just made and claiming it as Bernie. Just so you know.
Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.